Hello, welcome to my channel. So today we'll be going through the structure of the cardiovascular system as well as the functions as well. Okay, so this is another lecture on the anatomy and physiology uh, on the channel. Okay, so let's. So our objectives for today we go through. Of course, we're going to start with the introduction. Then we'll look at the structure of the heart, structure of the blood vessels, then physiology of circulation, heart sounds, the conduction system of the heart, cardiac cycle of the heart, and we look at some applied anatomy. We'll look at maybe ECG, and of course the physiology of blood pressure. Okay, that's what we are going to look at. Okay? So in our introduction, of course, you know that the cardiovascular system is the transport system of the body, and it comprises of blood, the heart, and the blood vessels. Then the system supplies nutrients and remove waste products from various tissue of the body. Okay, so in short, we are talking about this. Okay, so the cardiovascular system, of course, cardio is of course from the heart. Vascular, we are talking about the blood vessels. Okay, that's what we're talking about. Okay, blood vessels and of course blood, which passes through inside the blood, the same blood vessels. So, in terms of functions of the cardiovascular system, number one will be transport nutrients, hormones. Then, of course, to remove waste products as well, for gaseous exchange, immunity, blood vessels, transport blood. So, blood, of course, in blood there is oxygen and carbon dioxide, of course, nutrients and blood vessels as well, nutrients and waste products. Okay, so then the other function is, of course, has to do with the heart, where we say the heart pumps blood through the blood vessels. So this is one function. Okay, then the components of the blood, we are saying we have the cardio, which is the heart, then the vascular comprises of the blood vessels and the blood. So these are the components of the cardiovascular system: the blood, the heart, and the blood. Okay, so let's start with the heart. Okay, so the heart is a four-chambered oral muscular organ, approximately the size of your fist. That's the size of the heart. Then the four chambers, there is a ventricle, and you have the left and the right ventricle. There's the atria, we have the left and the right atria, and it is made up of cardiac tissue. Okay, then in terms of the layers of the heart, okay, you have the endocardium, which lines the heart chambers. Then you have the myocardium, which is the muscle layer. Then you have the pericardium, which is the membranous outer covering. The location of the heart, of course, is found in the superior surface of the diaphragm on the left side of the midline, and it is anterior to the vertebral column, then posterior to the sternum. Okay, that's the heart. Then these are the layers which we are talking about, the three layers of the heart. So the epicardium is of course the outer layer, so epicardium. So okay, so we go to the outer layer. This is where the epicardium is. Okay, this is where the epicardium is. Okay, so we have the in terms of the epicardium, we have the fibrous pericardium. Okay, then you have the parietal pericardium. Then you have the visceral pericardium. So visceral, it lines the heart itself. That's visceral. Then parietal lines the lining of the so the O itself is lined by the parietal pericardium. Then above the parietal pericardium we have the fibrous pericardium. Then in between the parietal and the visceral pericardium we have the pericardial cavity, where the pericardial fluid, of course, where the pericardial fluid, of course, is. Okay, so this is what we are talking about. We are saying, so the layer, the epicardium, the layer is the paratopericardium, and it is made up of connective tissue layers. Okay, then we go to the myocardium. So the myocardium is the muscle part. Okay, so the myocardium is the middle layer, mostly consists of the cardiac muscles, and good part for cardiac muscles are only found in the heart. So there you have it. It's the cardiac muscle found in the myocardium. Then endocardium, endo inside. So endocardium is the inner layer, and it's made up of the endothelium. So that's about the 3 layers of the heart. Okay, hope it's clear. So this is about the 3 layers of the heart. Okay, so in terms of structures of the heart, okay, so we just start from the let's start from the inferior vena cava, which is the, or which has been named as the posterior vena cava or the inferior vena cava. Then we have the superior vena cava, which has been named as the anterior vena cava. Then we have the pulmonary veins here. Then this is the right atrium. Then as you go down, you go to the right ventricle. Then as you also go down, you're going to find the semilunar valve, and as you go to the semilunar valve, one will go into the pulmonary arteries. Okay, so pulmonary artery and the left, these are the pulmonary arteries. Okay, then this side of the pulmonary veins. Okay, this side of the pulmonary veins. So the pulmonary veins are coming in, then you go into the left atrium, then you come down into the left ventricle, then you go inside, then you meet the semilunar valve. Okay, then you go and find yourself in the aorta. Okay, so this is about the structure of the heart. Then let's go to the atria. So the atria, we have of course two. We have the right atrium and the left atrium. So right atrium, which is abbreviated as RA, is the right upper chamber which received blood from the body. So the blood which is found in the right atrium is the deoxygenated blood. Then in the left atrium is of course found in the left upper heart and receives oxygenated blood from lungs and sends it to the left ventricle. Okay, so this is the left atria. Okay, and then we have the ventricles. So the ventricles, we have two ventricles in the heart. Of course, the ventricles are not only found in the heart. For instance, there are 4 ventricles inside the brain. So, but for the heart specifically, ventricles are 2, and we have the right ventricle, which is found in the right lower chamber, which receives blood from the right atrium and sends it to the lungs through the pulmonary artery. Okay, then you have the left ventricle, which is found in the lower left chamber, which receives blood from the left atrium and sends it through the aorta to the body. So this is about the right ventricle and the left ventricle. So these are the ventricles. So the right ventricle is this one, then the left ventricle is this one. In the atria are here. There is the right atrium. This is where the left atrium is. Okay. Then you go to the other structures such as the aorta and the pulmonary artery. Okay. So the aorta is the main trunk of the systemic arteries, which carries blood from the left side of the heart to the arteries of all limbs and the organs. So the aorta, we're talking about this big structure here. Okay, the main trunk. Then pulmonary artery carries blood to the lungs. So the pulmonary artery carries blood to the lungs. And pulmonary artery is the only artery which carries the deoxygenated blood. Hope you remember from your biology. Okay. Then heart valves, okay, so they allow blood to flow in only one direction. And we also have four valves. Okay, so we have four valves. The number one valve is the atrioventricular valves, which are found between the atria and the ventricles. And of course, since this one we on the left side there is the bicuspid valve, and on the right side there is a tricuspid valve. These are atrioventricular valves. Okay. Then we have the semilunar valves, which are found between the ventricle and the arteries. We have the pulmonary semilunar valve and the aortic semilunar valves. Okay, so we are saying there are four valves. Okay, but the four valves can be classified into two, of course. We have the atrioventricular valves, which are two, and the semilunar valves, which are also two. Okay, hope we have gotten something from there. Okay, so I say they have the pulmonary valve, tricuspid, bicuspid, aortic. This is what we were talking. Okay, so let's start now with the valves. Okay, so the tricuspid valve, which is this one, is the tricuspid valve. Okay, it controls blood flow between the right atrium and the ventricle. Then we have the mitral valve, which is also known as the bicuspid valve. Okay, this, so you have the tricuspid valve here, then you have the mitral valve here. Okay, then the mitral valve controls blood movement between the left atrium and the ventricles. Okay, so let's move. Then we have the pulmonary valve, which is now this part. Okay, then you have the aortic valve here. So the pulmonary valve controls blood movement from the right ventricle into the pulmonary artery. Then the aortic valve controls blood from the left ventricle to the aorta. Okay, so aortic valve from the left ventricle to the aorta, pulmonary valve from the right ventricle, then movement of blood from the right ventricle into the pulmonary artery. Then the way I remember them is this E start with this one starts with a T, this one starts with a P, this one starts with a A, this one starts with M. So they make T pump. Okay, T pump. So T P A M, T pump. Okay, from right to left. So if you go this side, T pump. So tricuspid, pulmonic, aortic, and mitral. T pump. TPAM, T-pump. That's how I usually remember them. Okay. Then let's go to blood vessels. So blood vessels, of course, they are, so the arteries are the distributing channel. They have thick old tubes. They are elastic fibers, and they have circular smooth muscles. And the capillaries, of course, these are microscopic vessels. They are one cell thick, and they serve and serves the respiratory system. And veins, of course, these are the draining channels. Okay, so let's start with the arteries. So arteries, these are tubes that carry blood away from the heart, and you have muscular. They have muscular elastic walls and form arterioles, which form capillaries and carry blood and oxygen to the body cells. Okay, then number one artery that we can talk about is the coronary artery, which supply blood to the heart. Then the heart needs a large amount of blood, and 5 to 7% of blood flow of the blood flow through the coronary arteries. Okay, that's it. This is the coronary artery on the right side and on the left side. This is how the coronary artery is. Then let's also look at some differences between the arteries and the veins. Okay, so direction of blood. For the arteries, they carry blood away from the heart, whilst veins they carry blood to the heart. In terms of pressure in the arteries, of course, find that the pressure is higher in the arteries, then whilst it is lower in the veins. Okay, then in terms of the walls, it is actually thicker. Um, in the arteries, we have the tunica media, which is thicker than the tunica externa. In the thinner, we have the tunica externa, which is thicker than the tunica media. Okay, then the lumen, we find that the lumen is smaller in arteries or larger in veins. Then valves, you have no valves in arteries, also have valves in veins. So these are some of the differences between the veins. Okay, so for the artery, we're saying the lumen is smaller. It's near the lumen is bigger. The artery does not have valves, and that the veins have valves. Okay, this is what we are talking about. Then the tunica media is actually thicker than the tunica externa for the arteries. Okay, that's what we are talking about. And of course they have elastic and collagenous fibers. Okay, so let's put the blood vessels. The blood vessels have three layers, which are known as tunics. We have the tunica intima, which is the endothelium. We have the tunica media, which is the smooth muscle. Then you have the blood vessels by the sympathetic nervous system. Then you have the smooth muscles, which are controlled by the sympathetic nervous system. Okay, not blood vessels. Okay, so let's continue. So the tunica externa, we have the mostly fibrous connective tissue. Okay, then this is the tunica intima we are talking about, which is the endothelium. Okay, endothelium of the blood vessels, the tunica intima. Then let's go to the capillaries. Capillaries are tubes that connect arteries and veins os on one cell under one cell thick, and they are a site for nutrients and oxygen from blood vessels and carbon dioxide and wastes to the blood. Okay, then veins, the capillary veins, they are tubes that carry blood. So for veins specifically, they are tubes that carry blood toward the heart. They have thinner muscular walls, they carry blood back to the heart, and they have cup-like valves to help move up. Okay, then in terms of circulation, we find that there is coronary circulation, pulmonary circulation, systemic circulation, and fetal circulation. So for coronary circulation, the circulation of blood within the heart, that's what we term as the coronary circulation. Then pulmonary circulation is the flow of blood between the heart and the lungs. Then you have systemic circulation, which is the flow of blood between the heart and the cells of the body. Then you have fetal, okay, which is of course when the flow of blood to and fro the fetus. Let's start with the systemic and pulmonary circulation. So pulmonary circulation, flow of blood between the heart and the lungs. Okay, then systemic circulation, flow of blood between the heart and the cells of the body. This is the blood circulation we're talking about. Okay, systemic circulation and pulmonary circulation. So this actually is a continuous process. Okay, systemic and the pulmonary circulation. This is how actually it is. When blood comes from the rest of the body, it goes to the heart. From the heart, it goes to the lungs for oxygenation. Then it comes back after it has been oxygenated to the right atrium, left ventricle. Then it goes to the aorta, then of course to the rest of the body again to supply blood. Again, it goes back again, back and forth. This is how it actually is, blood circulation. Okay, then let's go to the coronary circulation, which is the arterial blood supply. So for coronary circulation, of course, in terms of the arterial blood supply of the heart, we have the right coronary artery or the left coronary artery. Then you have the circumflex artery. Okay. Then you have the anterior interventricular artery of the posterior interventricular artery of the marginal artery. Okay, these are some of the things that you actually need to consider on the arterial supply. Of course, in the other arterial of the left coronary artery, which was already mentioned, these are some of the arteries. Then portal circulation is the flow of blood between two sets of capillaries before draining in a system veins. Okay, So portal secretion, for instance, the hepatic portal secretion is one of the portal secretions where there is flow of blood between two sets of capillaries before draining in systemic veins. So from the guts, from the intestines, then it goes and connects with itself before then to pass through the liver. So this is the hepatic portal secretion. Okay. Then the fetal secretion is the flow of blood, of course, from the mother to and forth to the fetus. But this section specifically will be discussed in the next tutorial for anatomy. So meaning we are going to discuss separately the fetal secretion. You have to stay tuned. Then the art sound. So the art sound, the normal, of course, the lab dub are associated with closing and the art valves. So the first sound to the lab occurs as atrioventricular valves close and signifies beginning of systole, which is a contraction. Then the second sound to the dub occurs when the semilunar valves closes at the beginning of the ventricular diastole, which is relaxation. So contraction will give you a lab, relaxation will give you a dub. Okay, that's the out sounds. Okay, up dub. Then the conduction system of the heart, of course, we have group of structures that send direct impulses through the heart. And one of the sinoatrial node, which is found in the O of the right atrium and generates impulses. So this is the natural pacemaker because it's the one which actually generates the first impulses. And after it generates the impulse, it's going to send those same impulses to the AV nodes. Then you have the AV node, of course. The AV node is the atrioventricular node. It is found between the atria, just above the ventricles. And when the atria contract, it sends impulses to the bundle of ease. Okay, bundle of ease. Okay. So that's what we are talking about. So if from as the impulses go to the bundle of ease, we have the impulse goes to the bundle of ease. The bundle of ease are found in between the ventricles, and they make two branches, and they form, and they will going to send the same impulses to the Purkinje fibers. Okay, then the Purkinje fibers are found in the lateral walls of the ventricles, and as the ventricle, that's when the impulses will be transferred for them to actually contract. Okay, this is the conduction system of the heart. You are saying inside the right atrium we have the sinoatrial node, okay, which is the pacemaker. Okay, so not initiates the impulses. Okay, so as the impulses are sent to the atrium, there is another one which receives the same impulses, which is found just above the ventricles, which is the AV node. So the AV node is found here just above the ventricle. Okay? This is the AV node. So the AV node will send the information, the AV bundle, of course. Okay, then it's going to bifurcate into two branches, with the left bundle branch and the right bundle branch. Okay, then as it goes, it's going to find the Purkinje fibers this side. Okay, so the information will travel this side, will go to the left ventricle and find the Purkinje fibers. Then the Purkinje fibers will send information to the ventricles for them to even contract. So this is a cardiac conduction system. Okay, hope we have made sense. Okay, so the heart's cardiac cycle actually refers to all events associated with the blood flow through the heart. So systole, we are talking about contraction of the heart. Then diastole, we are talking about the relaxation of the heart muscle. Okay, so systole, okay, the contraction of the heart. Diastole, relaxation of the heart. So one heartbeat is equal to one cardiac cycle. Then atria contracts and relax, ventricle also contracts and relaxes. Then in the right atrium, when the right atrium contracts, the tricuspid valves opens, and blood fills the right atrium. Then the right atrium. So before that, so the right atrium, the right ventricle contracts, then the tricuspid valves closes, then the pulmonary valves opens, then the blood vessels flows. The blood flows into the pulmonary artery. Okay, that's what's going to happen. So that's for the right atrium and the right ventricle. Okay, so in the left atrium, we find that the after blood goes into the left atrium, the bicuspid valves opens, then the blood fills the left ventricles. Once it goes into the left ventricles, it contracts and the bicuspid valves closes off and the aortic semilunar valve opens and blood is pushed into the aorta. So that's what happens. Okay, so let's just repeat. We are saying the right atrium contracts, then the tricuspid valves opens, blood fills the right atrium. Okay, then the right ventricle is going to also to contract and the tricuspid valve is going to closes off, pulmonary semilunar valve opens and blood flows into the pulmonary artery. Then the right ventricle, the bicuspid valve opens and blood fills the left ventricle. So when it goes to the left ventricle, it's also known as contract, and the bicuspid valve closes off, and the aortic semilunar valve opens, and the blood is pushed into the. These are the phases of the cardiac cycle. So we have the ventricular filling, so means to rate diastole. So the ventricular filling is when blood go into the ventricles, of course. Then you have the arterial contraction. This happens in the ventricular filling stage. Then you have the ventricular systole, which is the atria in diastole. So the ventricular systole, you find that when the ventricles want to contract, you have this happens when you have isovolumetric contraction phase, where there is which is a this side, and next it will lead to a ventricular ejection phase, where now the ventricles contract and they eject blood into the pulmonary artery this side and this to the aorta this side. Okay, then you have the air diastole, which is where there is also isovolumetric relaxation, and remember there is actual blood which is remaining inside the ventricles. Okay, and since we are also going to go back to the ventricular filling again, so that's the phases of the cardiac cycle. Okay, then let's talk about the cardiac output. So cardiac output or minute volume is the amount of blood ejected each minute. Then the formula for cardiac output is stroke volume multiplied by the heart rate. So stroke volume multiplied by the heart rate. Then the normal cardiac output is 5040 mils per mil. Then the stroke volume is the amount of blood ejected from the heart at each contraction to the ventricles. And the normal stroke volume is 70 mils. Okay. Then in practice, we have what we call the electrocardiogram, okay, ECG. So in general, when muscles contract, there is a change in the electrical potential across the membrane of the muscle fibers. Similarly, in the cardiac muscles happens, of course, the same. So as the body fluids and tissues are good conductors of electricity, the electrical changes occurring in the contracting myocardium can be detected by attaching electrodes to the surface of the body. And the pattern of electrical activities may be displayed on the oscilloscopy screen or printed out on paper. This tracing is called the same electrocardiogram or ECG for short. Then the normal ECG usually shows 5 waves, which are named as P wave, Q wave, R wave, S wave, and T wave. Those are the detects. Then the P wave detects impulses of contraction within the atria. Then the QRS complex or the QRS wave spread show spread of the impulse uh, of contraction through the conducting tissues, the ventricular muscle. Okay, then the QRS wave will show the ventricular contraction. Okay, then the T wave is when there is the relaxation of the ventricular muscle. So examination of ECG will give information about the state of the myocardium and the conducting system within the heart. So ECG acts as diagnostic value, as variation in graph indicates the heart diseases. So you can actually use it to even make diagnosis of heart problems, okay, heart disease. Then the instrument used in recording the ECG is called the electrocardiography. Okay, that's about ECG. So this is how ECG can show you, okay, or the P wave, the PQ interval, the QRS complex, okay, then have the ST segment on the T wave, then you have the QT interval. Okay, so this is electrocardiography, how it can show. Okay, so let's continue now from the applied anatomy. We have the major arteries of the systemic circulation. These are the major arteries of the systemic circulation, which of course you can't manage going through all of them. You can just pause the video, I'll give you 3 seconds, then you pause the video and go through. Okay, so hope you have paused through and you have gone through most of the major arteries of the system. Okay, the next of the major veins of the systemic circulation. Okay, so we have, for instance, here on the arms, of course, of the digital veins, you have the ulnar vein, the radial nerve. Okay, then the other ones you can pause. I'll give you again 2 seconds for you to pause and go through all of them. Okay, so 1, 2. Okay, so you paused and have gone through, and let's continue. Okay, then let's continue. So of course, on the cubital part of the median cubital veins and the basilic veins of the cephalic veins. So these ones are important because actually in practice you find that they are the ones which you usually like to cannulate on, okay, or even do vein punctures on. Okay, let's go to the heart rate. So the heart sound during, of course, contraction and relaxation produces mainly due to the closing of the valves, so the lab dab. Okay, so the heart rate is recorded by using the stethoscope. And the normal heart rate is 60 to 80 per minute. Then, of course, the heart rate cannot only be recorded by the stethoscope. You can also even calculate the heart rate. Uh, so the heart sounds are recorded by the stethoscope, not the heart rate. So the heart rate can be recorded by palpation of the part of the arteries, also calculate using the sphygmomanometer, which is known as the blood pressure machine. Okay, you can even just count per minute where you touch the arteries and you start counting. Okay, so that's the heart rate. So, but you can even use the stethoscope. It's also fine where you measure the heart rate on the, especially on the cubital fossa. You can measure the heart rate on the cubital fossa. So in short, there are a lot of things which we use to measure the heart rate. Stethoscope is also one of them. We have the blood pressure, which is sphygmomanometer. We also have even other things such as pulse oximeters. Okay, in as much as they detect how much oxygen is flowing into the arteries, they also show you the heart rate. Then the normal heart rate is per minute. In other literatures, most of the literatures, in this literature specifically, says 60 to 80, but most literatures will tell you 60 to 100 per minute. Okay, hope we are together. 60 to 100 per minute, that's the normal heart rate. Okay, 60 to 100, remember 60 to 100. Okay, then the heart rate can either be normal or abnormal. Abnormal can be more than normal, which meaning more than 100, or less than normal, which is specifically we consider less than 50 as less than normal, because we find that for 50 to 60 athletes, those who are actually athletic, can be falling between 50 to 60. Okay, when the blood is more than normal, meaning more than 100, we call it tachycardia. When it's less than normal, meaning less than 60, we can call it bradycardia. Then the blood pressure, which is the force called radial pressure exerted by blood on the walls of the blood vessels. And there are two types of pressure. There is the systolic BP, which is the systolic blood pressure, which is the pressure exerted during the systole, which means contraction of the muscles, and it is called systolic blood pressure. And normal systolic blood pressure is 120 millimeters of mercury. Okay, then the systolic BP may vary from 100 to somewhere 150, and most literatures will again tell you will vary from 100 to 140. Okay, that's depending on the literature we're dealing with. Then diastolic BP, the pressure exerted during diastole, which is the relaxation of the muscles, is called the diastolic blood pressure. And the normal diastole is 80 millimeters of mercury, and the range for the diastolic BP is 60 to 90, and most literatures also just go with 60 to 90. Okay, then we have the pulse pressure. The pulse pressure is the difference between the systolic and the diastolic blood pressure, which is called the pulse pressure. So factors maintaining blood pressure of the contractile force of the heart, cardiac output, elasticity of the walls of the heart, vessels, volume of blood circulated in the circulating system, peripheral resistance. Factors are, of course, these are factors that are maintaining blood pressure. Then the ones that affect blood pressure are physiological conditions such as exercise, emotional conditions, age of the individual, and as well as body weight. Then blood pressure is measured with the help of an instrument which is known as the sphygmomanometer, which is the one people here refer to as the BP machine. Okay, but the name of the BP machine or the instrument itself is sphygmomanometer. Okay, then this is how you measure blood pressure with the sphygmomanometer, and you, of course, as how you do it. Okay, so this is how you measure the blood pressure. So, but this one is there are newer versions of the sphygmomanometer, the BP machines, they are called. We have newer we have newer blood vessels. We have newer BP machines. So this one specifically was used. When using this one, you find that you of course wrap the rubber cuff on the patient and inflate with air. Okay, so as you are inflating with air, you reach somewhere 120, and the pressure in the cuff above 120, and of course if there are no sounds audible, then if you go below it, then you put the stethoscope. If there are sounds audible in the stethoscope, then so you have marked your 120. Okay, and we have to put the pressure in the cuff below 120 and above, but above 170. So should be falling in between, the pressure should be falling in between here. Okay, so as you are listening, then you have to again the pressure in the cuff below 20 where there also no sounds audible. Then that's how you actually measure. But for now we have digital sphygmomanometer, so there's no need for it to actually do this manually. Okay, so you have the pulse. So pulse, this is the pressure wave of blood. It is monitored at pressure points where pulse is usually palpated, and the normal pulse rate is, of course, like I said, 60 to 100. Remember, 60 to 100. And where can you do? Okay, where can you measure the pulse rate on? You can measure on the temporal arteries, the facial artery, carotid artery, the brachial artery, the radial artery, femoral artery, popliteal artery, posterior tibial artery, the dorsalis pedis artery. These are the pressure points where you can measure pulse. Okay. Then some diseases that disorders of the cardiovascular system we can have. So these are conditions, applied anatomy. We can have arrhythmias where there is abnormal heart rhythm. We can have carditis, which is inflammation of the heart. Endocarditis, inflammation of the innermost lining of the heart, including valves. We have myocarditis, inflammation of the muscular layer of the heart. Pericarditis, inflammation of the membranes that surround the heart. We have congestive heart failure where there is weakening of the heart over time and the heart is unable to pump enough blood to meet the body's needs. You have the coronary artery disease, which we can have a lot of coronary artery diseases. An example would be atherosclerosis, which narrows the coronary arteries caused by hardening of the fat plaque deposits within the arteries. You have hypertension, which is high blood pressure, consistent resting blood pressure equal to or greater than 140 systolic, 90 diastolic. So these are conditions of the heart. Then you have thrombophlebitis, which is a blood clot and inflammation developing in a vein, varicose veins, twisted and dilated veins, myocardial infarction, in German language known as an heart attack, damage the cardiac muscle due to lack of blood supply. Then you have murmurs, which are just abnormal heart sounds. You have angina pectoris, which means that which is of course chest pains, and it is actually very severe pain beneath the breastbone, and in many cases in the left shoulder and arm. Okay, so meaning there is radiation of pain in the left shoulder and the arm, and it's due to the heart muscle being inadequately supplied with oxygen. The commonest cause of this disease is of course again arteriosclerosis of the coronary arteries. Then you can have stenosis where there's narrowing of the valve. You can have hemorrhoids where the rectum veins are dilated. You can have arteriosclerosis itself where there is hardening of the arterial walls due to deposition of cholesterol in the blood arteries. And specifically the deposition of the cholesterol inside the intima, the tunica intima of the blood arteries. Then it results in the partial loss of elasticity of the arteries. It usually results in hypertension. So that's why it's very common for someone with diabetes to actually develop hypertension. Okay, then some procedures that can be done in surgery on the heart. We can do a bypass where someone can actually bypass from the ascending aorta, and they graft a blood direct into the coronary artery if there is a blockage or obstruction on the coronary arteries. Okay, so we can actually bypass them. Okay, then the other procedures can be done is the percutaneous transluminal coronary angioplasty, where they actually now dilate we'll put a balloon catheter and inflate the balloon, which is threaded in the obstructed area, and then the balloon is inflated, it stretches the arterial wall and squeezes the atherosclerotic plaque. And after the lumen is widened, the balloon catheter is of course withdrawn. Okay. Then the other thing which can be done is the artificial heart. Okay, so is the artificial heart which can be put. Okay, then apart from the artificial heart, you can also put the pacemaker. So an artificial pacemaker, so artificial pacemaker can be made in addition to the artificial heart. Okay, so the artificial pacemakers are one which are commonly done. So thank you for watching. If you haven't subscribed, please subscribe and hit the bell notification, and see you on the next tutorial.